Mac is a 3-year-old male neutered golden retriever who came into the clinic with signs of lameness and head tilt when walking. Upon physical assessment, he was found to have a right stifle cranial cruciate ligament rupture and underwent cruciate repair surgery. He was referred to physiotherapy 1 week after surgery. Mac was bought as a puppy from a backyard breeder that did not provide hip or elbow scoring. He was likely predisposed to suffer from a CCL rupture as a result. His owners are middle-class workers in their mid-50s. They go for daily walks with Mac, but sometimes are not able to note when Mac is overexerting himself, typical of golden retrievers. His owners noticed one day that Mac started limping and showing lameness in his right hind limb after playing with Fetch for roughly 20 minutes. They are not well versed in scientific language but are very committed owners and listen well in consults. They don't appear to have financial constraints and speak fluent English. We have developed a physical therapy treatment plan for this condition as a support guide to the physical therapy program that has been handed to you in a booklet. It is important that you follow both the plan and this video to ensure the best outcome for your pet. In this educational video, we will take you through the phases of rehabilitation and the exercises that you and your pet will have to perform. This includes passive exercises, active exercises, cold therapy, hot therapy, and hydrotherapy. Your role is to ensure that these instructions are followed. This phase is from 0 to 6 weeks after surgery. The goal of this phase is to ensure that your pet will not suffer from negative changes that may occur due to a lack of movement such as muscle loss or reduced range of motions. It is therefore important that you follow these exercises so that these negative changes do not occur. In this phase, you will have to perform massage daily. The goal of massage is to remove waste products in the body and improve circulation, reduce swelling and fluid buildup, and aids in relaxation. The first type of massage is stroking. Here, you gently glide your hands over the body. Next, you may move on to a fleurage. For this technique, guide your hands in the direction of the heart. Kneading. In this method, you create upward pressure to tissues with your hands. Remember, not to pull or grip tissues and not to force the limbs into awkward extensions as this may cause injury. You will also have to perform stretching as part of passive range of movement exercise, also known as PROM. The goal of stretches is to maintain hamstring muscle groups, joint flexibility and muscle length. Each day, perform 3 stretches into resistance for 15 seconds for all 4 limbs. Remember, focus on hip flexor muscle groups. Stretching must not be painful for the animal. PROM is the next exercise that you will have to perform. It is similar to stretches and helps to maintain joint range of movement, reduce instability of the stifle and prevent a limited range of motion. To perform this, gentle move the limbs along its normal range of movement, 3 sets of 10 repetitions per day. Remember, not to extend to the point of pain or more than what your pet can handle. Two weeks after surgery or referral, you may begin to perform active assisted exercises with the help of a towel underneath the dog, close to the hind limbs. The goal of active towel assisted exercise is to introduce more intense exercise while still being supported to avoid risking injury. This is best done in short periods and with passive range of movement exercises for maximum benefit. Walking on incline, short, slow lead walking. Walking over poles and broomsticks with towel wrapped underneath. Sit to stand practice, pull treat forward. Figure 8 exercises. Remember, gentleness is key. Do not force the patient or overexert the patient. Always use a towel at this phase of rehabilitation. Cryotherapy involves using an ice pack with a towel for insulation. It is similar to the way it is used in humans. The goal of cryotherapy is to relieve pain, reduce swelling and inflammation, and decrease the temperature of the affected area. To do this, apply 10 minutes 2 to 6 times a day but no more. Remember, tissue damage can occur if used for more than 20 minutes at a time. Hydrotherapy involves the use of water for the purpose of rehabilitation. While you as a client cannot perform hydrotherapy by yourself, it is your role to ensure that you follow through with appointments booked in for hydrotherapy sessions with a qualified hydrotherapy nurse. The frequency and duration will vary depending on your case and will be decided by your physiotherapist. In general, the level of difficulty will be gradually increased by altering the water levels using a flotation device and increasing the duration of each session. Factors such as age of patient, patient tolerance level, and rate of healing will be taken into consideration. Phase 2 begins 6 weeks after surgery up to 6 months. It involves intensified physiotherapy in line with the increased capabilities of your pet as he or she continues to get stronger. The purpose of Phase 2 is to introduce active exercises without the use of a towel and to introduce more difficult exercises as well that your pet will not and should not do before 6 weeks. The purpose of Phase 2 is to also maintain the progress that has been made in Phase 1 through continuing with prompt exercises as well. In this phase, you will have to begin active unaided exercise without the use of a towel. The goal of active exercises is to return to normal limb function, improve gait and form, prevent biochemical and metabolic changes in the affected limb that occurs because of lack of movements and immobility. Technique 1. Weaving cones. Technique 2. Cavaletti poles. Technique 3. Up and down stairs. Technique 4. Wobble cushion. Technique 5. Progressive walking program. The goal of hot packs is to reduce pain and increase healing speed. You can use it 15 to 30 minutes once per day. Remember that you can only use it at this phase of healing as hot packs will increase swelling and inflammation if used in the first phase. Finally, there is the third and final phase, maintenance physiotherapy. This begins 6 months after surgery. The purpose of this phase is to maintain all of the gains and improvements that have been made in the last 2 phases. It helps to consolidate all of the work you have done and help to continue maximizing outcome and minimize the risk of injury. In this phase, you will continue to perform massage, range of movement exercises, strengthening exercises, hydrotherapy. Off-lead running can also be resumed. Kindly contact your qualified physiotherapist at Pittsfield North Veterinary Physiotherapy should you have any questions.